Передаю слово Вільяму Бернету.
Okay, thank you very much, Simone Jen, for that introduction, and thank you also to Maria and Elena for helping to make this event possible to do. So it's nice to be here with everybody. I want to thank all of you, so many people, for coming to this webinar today. And as you know, what we are going to be talking about is the identification and the diagnosis of parental alienation. And let me start. I always like to start. Let's see if I can change the slide here. There we go. I always like to start with a definition of parental alienation. So let's go through this together. That we're referring to how a child, usually one whose parents are engaged in a high conflict, separation, or divorce, allies strongly with one parent, the favored parent, and rejects a relationship with the other parent, the alienated parent, without legitimate justification or without a good reason. So the part here that seems most important is that this usually happens in a high conflict divorce, although I want you to know that occasionally this happens even without a divorce, when everybody is still at home in one household, alienation can occur. And secondly, a big factor is that this is without a good reason. So if a child rejects a parent for a good reason, that's something else. That's not alienation. Alienation is when the child rejects a parent without a good reason, although it's because of being indoctrinated by the favored parent. So some people like to have this family diagram. And as you can see in this kind of situation, the preferred parent or the favored parent and the alienated parent are blaming each other. The child is having a problem and both parents blame the other parent. This yellow arrow here is what we call parental alienation. In other words, it's the mental state of the child in which the child rejects the alienated parent. And over here is what we call alienating behaviors. So to put it simply, the preferred parent exercises or shows alienating behaviors, and those alienating behaviors cause the child to reject the alienated parent. What we're going to talk about today are these topics. First, the 5-factor model for the identification or the diagnosis of parental alienation. And then I'm going to say a few words about the consequences of parental alienation for the child. And then a few words about a little bit of a short history of parental alienation. And after that, we will have time for some questions and some discussion. So when we're talking about the 5-factor model, these are the 5 components of the 5-factor model. Let's go down these quickly. Number 1, the child manifests contact refusal. Number 2, in the past, there was a good relationship with the rejected parent. Number 3, there's no history of abuse or neglect or highly deficient parenting by the rejected parent. Number 4, there are alienating behaviors by the preferred parent. I mentioned that just a moment ago. That big red arrow are the alienating behaviors by the preferred parent. And number 5, the child manifests some typical signs or symptoms of alienation. Now, I need to point out that all these 5 factors are not new. They've been here for many, many years, 30, 35 years. But what we have done, my colleagues and I have pulled them together and put them in one list. And this list is the 5-factor model. And this is all written about in several places. One place is our book that came out a year ago called Parental Alienation, Science and Law. And there are 2 chapters in this book that talk about the five-factor model, the chapter by Dr. Baker, which has to do with research, and the chapter by Dr. Freeman that has to do with evaluation. But in addition, this five-factor model has been written about in an article that has been distributed to you. In other words, the article was published in a journal in Ireland, the Journal of Family Therapy, and it was translated into Ukrainian and distributed to you, and it was also translated into Russian. And all three of these versions, the English, the Ukrainian, the Russian, all of them are on our website that you can find them if you want any of those articles about the five-factor model. So let's go through these five factors. Number one, the child manifests contact refusal. That means that the child is saying, I don't want to see one of my parents, either my mother or my father. It could be either one. And how do we know that's happening? Usually when we do a diagnostic evaluation, everybody agrees that that's happening. It's not a mystery that the child is refusing to see one of the parents. And so usually the mother, the father, the therapist, the attorneys, everybody agrees that this is happening. But what's important in this model is we talk about the severity of parental alienation. And what we would say is the severity of parental alienation is based on factor one, is to how much does the child reject one of the parents? And that is mild, moderate, or severe. In a mild case, the child says, I don't want to go see daddy, for instance. Let's say daddy, I don't want to go see daddy. But the child goes anyway, and once the child is with daddy, he's fine and gets along and cooperates and enjoys himself. A moderate case is the child says, I don't want to go see daddy, and he goes, but he's difficult and he's oppositional while he's with the rejected parent. In a severe case, the child says, I don't want to go see daddy, and doesn't go. In a severe case, the child refuses to see the rejected parent at all, and might not see that parent for months or years. Now, there are some situations where the child does go and sees the rejected parent, but is still considered severe. And that's if the child is very, very oppositional during the entire visit. For instance, the child will not talk to the parent or will not eat with the parent. The child will take his own food and go to his room and stay in the room and shut the door and eat his own food that he brought with him. In other words, he does not interact at all. So that can be called a severe case, even though the child does go back and forth. So that was factor one. Here's factor two, that in the past, there was a good relationship with the rejected parent in the past. And usually people agree on this also. For instance, both the mother and the father will say, oh, many years ago, the children got along with everybody, with mom, with dad, and with everybody. But sometimes you have to be able to prove this. And usually you can have videos or photographs or cards that the child wrote and said, I love you, daddy, I love you, mommy. So sometimes you can find lots and lots of evidence that in the past, there was a good relationship before this problem started. Sometimes you can get information from other people, like relatives, or even diaries that have been written. So number three is important because the third factor is the absence of or the lack of abuse or neglect or highly deficient parenting. Because if the rejected parent has a history of abusing the child or being a really, really poor parent, well, that's a reason for the child to reject that parent. And as you know, in alienation, there's not a good reason for the rejection. So sometimes the evaluator has to do some research to see whether or not there was abuse or neglect in the past. And you have to interview family members, you collect information from other people, you look at records from medical personnel, from doctors, from child protection offices, from law enforcement places, to see whether or not there's a history of abuse or neglect. Now, if there is, incidentally, parents are never perfect. So sometimes the rejected parent has done something which is not very good. In other words, if it's the dad, the dad wasn't always a perfect dad, and the dad may have made mistakes and done things that were not the right thing to do at times. But the principle in alienation is that the child's rejection of dad or the target parent is far out of proportion to anything that the parent has done. In other words, the parent maybe had made a mistake, but the child says, I never want to see you again. I totally reject you. I never want to see you again. So the child's rejection is far out of proportion to anything that the parent has done. So we're going through the 5 factors. Here's number 4. And this refers to the alienating behaviors that are manifested by the favored parent or the preferred parent. So I want to talk about some of these. There are actually 17 of these on this list. So I don't think we have to talk about every single one, but let me talk about the ones that are most important. The most common one is number 1, where it says denigrating and criticizing the other parent. The favored parent will over and over again say things to the child that criticizes the rejected parent. And so the child, of course, gets the message that there's something wrong with the other parent. But it's not just to the child. The favored parent will say negative things to other people in the community, to other family members, to people at the school, to the doctor, to the therapist. And so this pattern by the favored parent of denigrating and criticizing the other parent goes on in many different places. Another common alienating behavior is limiting the child's contact with the other parent. For instance, the mother, suppose it's the mother, will say, oh, Jimmy does not want to go see you. Jimmy's busy this weekend. Jimmy has other plans this weekend, so he's not able to go visit you. Or the mother might interfere with communication. In other words, suppose the dad tries to call Jimmy up on the telephone and the mother won't answer the phone or won't let the child talk on the phone. So here's some more of these alienating behaviors. If you look here, one of them says, allowing the child to choose between his or her parents. That's very, very common. Suppose the dad is alienating parent, and the dad will say to the child, you can do what you want. You're old enough. You're 10 years old. You're old enough to decide what you want to do this weekend. And I had one case where the dad said, this is the weekend to go visit your mother. Do you want to go visit your mother, or do you want to go fishing with me? And the 10-year-old boy is going to say, well, I guess I want to go fishing with dad. So this is a common strategy where you let the child decide to go have parenting time or to have visit with the other parent or not. The next one is also very common, creating the impression that the other parent is dangerous. And you do this you can do this in a roundabout way. You can say, when the child comes back, the parents, the dad, for instance, can say, did your mother do anything this weekend to you that bothered you? Did your mother hurt you this weekend? Or the dad can say to the child, Jimmy, when you're with your mom this weekend, if she does anything that bothers you, call the emergency number. And in this country, in the United States, the emergency number is 911. And you probably in Ukraine have a similar system that you can call a particular number. And the dad will say, if mom does anything to bother you, call 911. In other words, the dad is telling the child that the mother might be dangerous in a roundabout way. Here are some more alienating behaviors. One of them says asking the child to spy on the other parent. For instance, the child might take a cell phone and take pictures of things in the other parent's house, asking the child to keep secrets. One of these is withholding medical information. For instance, the alienating parent won't tell the other parent things that happen at school, when there's going to be a football game, when there's going to be a music recital, and so on. And here's just a couple more things. Confiding in the child about the case, about adult matters, and similar things. So these, I just want, there are 17 of these, but in order to have a case of parental alienation, you don't have to have all 17. Typically, if you're doing an evaluation, you only identify a few of them. But sometimes there's one that happens over and over and over again. For instance, suggesting that the other parent is dangerous. Well, the preferred parent might do that over and over and over again in many, many different ways. And so that constitutes factor 4 of these factors. Now, I need to say something about where did all this come from? There's been research on factor 4 on these alienating behaviors. And as you can see in this, some of it was done by this psychologist who's well known, whose name is Amy Baker. She did a couple of these research projects, and then another psychologist named Jennifer Harmon, and another one named Mandy Mathewson. So these things have been published. And for instance, they collected many, many different things that happen in alienated families. They had hundreds of them, and then they make them into a list. And that's how we come up with these 17 that happen over and over again. So when I mentioned this, these 17 factors, we didn't just, dream them up or imagine them, but they're based on research that was conducted several years ago. Now, I already mentioned how parental alienation can be classified mild, moderate, severe, but also alienating behaviors can be classified mild, moderate, and severe. And here are some examples of how to do that. In mild cases, the preferred parent only says a few things, sort of in passing or accidentally makes statements that might undermine the child's relationship with the other parent. So it's almost accidental. In moderate cases, the preferred parent does it on purpose, but he or she is not really determined to ruin the relationship with the other parent. And if you advise that person, they usually correct themselves. They usually stop doing it. In severe cases, the expression that's used is that the favored parent is obsessed with the desire to destroy the child's relationship with the other parent. And no matter how much counseling or how much advice or even what the judge says, it does not stop. Then in severe cases, the preferred parent keeps it up over and over and over again. And that's why we would say that in severe cases of alienation, that if the preferred parent is acting in this way, that it is child abuse, that it is a form of child psychological abuse for the preferred parent to go on and on in trying to destroy the child's relationship with the other parent. So there's one more factor. Factor 5 is what happens in the child. So I guess you've seen that in these 5 factors, some of them pertain to the rejected parent. Some of them pertain to the preferred parent or the alienating parent. And now this one pertains to the child. And here there are 8 signs or behaviors that happen in children who are alienated. And these go way back. These were first listed in 1985 by Richard Gardner. And many people have studied these and have described them in many, many countries and in many, many articles in journals. So these are kind of famous. Let's go down these 8 symptoms. The first one is the child's campaign of denigration of the rejected parent. So what that means is the child comes into an appointment with the person who's doing the evaluation, and from the very beginning says, let me tell you about all the things that dad does. He does so many bad things, and let me tell you about them. In other words, the child comes forward with these criticisms of the rejected parent. And then the second one of these factor 5 items are weak rationalizations for the rejection. So even though the child says, I never want to see mom or dad again, they can't really give a good reason. They give reasons that are frivolous or silly. For instance, a lot of times it has to do with vegetables. The child doesn't like to eat vegetables, and the child will say, my mother made me eat broccoli, so I don't want to see her again. I had one girl who said, I never want to see dad again because I don't like my room. He decorated at my dad's house, he decorated my bedroom, and I don't like the way he decorated my bedroom, so I never want to go see him again. When these happen, they're very striking. In other words, the diagnosis of alienation is not mysterious. These behaviors are very prominent and very striking. Here's another one that's very important: lack of ambivalence. This refers to the idea that the child says one parent is all good and the other parent is all bad. And this has been described by many, many people, many psychologists and psychiatrists in different articles over many years. And what's interesting is this lack of ambivalence is splitting of one parent is good and the other parent is bad does not always show up in everyday life in the homes, but it's easy to show in an evaluation. And I'll give you an example. For instance, what I do sometimes is I make a list, and I write at the top of the page, mom, and I put the mom's name. And then I say about her, things I like and things I don't like. And then I have a page for dad, the dad's name, things I like and things I don't like. And I show this to the child. In other words, I'm not keeping a secret. I show it to the child, and the child helps me fill this in. And a normal child, even a child whose parents are divorced, will say some good things about dad and some negative things about dad. The normal child will say some good things about mom and some negative things about mom, because they have what's called ambivalence. In other words, it means they have both good and negative feelings about mom and about dad. But what would an alienated child do? An alienated child would engage in splitting, which means that suppose the child is alienated from the mother. When the child fills out this page for the mother, everything is negative. One thing after another after another. I don't like the way mom cooks. I don't like the way mom makes my bed. I don't like the way mom wakes me up in the morning. And nothing positive. But in the page for dad, everything is positive and there's nothing negative. In other words, in the child's mind, one parent is totally good and one parent is totally bad. And you can do that, you can elicit that simply in an interview, in an evaluation. And also, there's a test that we've used in research, but also people are using it in evaluations. Excuse me. I'm Excuse me, but everybody's okay. So there's this test called the Parental Acceptance Rejection Questionnaire. It's called PARQ. And I've used this in research. And what I found was that this shows splitting of the child of the two parents. In other words, on this questionnaire, the child will say that one parent is totally, totally good, and the other parent is totally, totally evil. And so you can show this lack of ambivalence. You can show it just in an interview. You can also show it by using this kind of test that's available, for psychologists and other people to use. So I'm going down factor 5. Another one is called the independent thinker phenomenon. And the reason why independent thinker is in quotation marks is because the child pretends to be an independent thinker, but really isn't. And this comes up in interviews where the child comes in and says, Dr. Bernet, people think that my mother is causing me to have this bad opinion about my dad, but that's not the case. These are all my own opinion about dad. In other words, the child independently volunteers that these are his own ideas. And everyday children don't do that, but alienated children sometimes come into the appointment and say that. Here's some more components of factor 5, that the child automatically supports one parent against the other. And a person who's doing an evaluation might see that. For instance, suppose there's a family meeting and there's a discussion of some topic, and the child will immediately take sides with one parent and disagree with the other parent. And they do this over and over again. The next one says absence of guilt toward the rejected parent. And that's where the child does very mean things, but doesn't apologize and doesn't seem to feel bad at all about being very rude and very mean toward one of the parents. The next one is borrowed scenarios. That means that the child copies the preferred parent in describing certain situations. For instance, in conducting an evaluation, perhaps the dad comes in and says certain things about mother, 1, 2, 3, 4. And then the next day, the child comes in and says the very same things. The child has the very same criticisms of mother, 1, 2, 3, 4. And so that's called borrowed scenarios. So that's something that one would see in an evaluation. So the next one is you would see actually out in the community, out in the homes, animosity for the extended family. So the child will say, I never want to see mother again. And also, I never want to see my grandparents again. My mother's parents, I don't like them either, because one time they said something I didn't like. So there's a trivial reason. And so that the animosity spreads from the parent to his or her family members. So these are the common 8 signs or symptoms in the child. And these have been around since 1985, but not every case has all 8 of these. In more severe cases, the child typically manifests 7 or 8 of these, but in less severe cases, not so many. So here's something interesting that happens. That there's a sequence of events in the child. That the child might start by making false statements, saying, I don't want to go see dad. My dad broke my arm when I was a little boy. And that's not true. In other words, that's something that the child has heard, but that is not true. That is false statement. The dad did not break the child's arm when he was a little boy. So that's a false statement. And after that, after a few times, the child will have false beliefs, that the child will start to believe that these things actually happen. And then sometimes, after a period of time, the child will have false memories the child will actually have a memory of some incident where he hurt his arm, and he has this memory that the dad broke his arm. So you can see how this can be very ominous, because when children start developing false beliefs and false memories, they actually believe these things. And as a result, when they're interviewed, they can be very convincing, even though these things never happen. So I mentioned earlier research about alienating behaviors. Well, here's research about factor 5, the 8 common symptoms of alienation in the child. And Amy Baker has done some of this. I mentioned that use of that test called the PARQ. So I have listed here the reference where we published that. The PARQ is a test for splitting in the child, which is one of those 8 common symptoms. And then finally, this reference to Richard Gardner is when these 8 symptoms were originally described in this paper that he wrote in 1985. So one of the things we have to repeat, I mentioned this a little bit earlier, but we have to make sure that everybody understands the difference between alienation and estrangement. We use the word alienation when the child rejects a parent without a good reason. And we use estrangement when the child rejects a parent because they have a good reason, like a history of abuse or neglect. And at least in the United States, these terms have been accepted. Alienation means one thing, estrangement means other thing, something else. And I know that in other countries and other languages, there might be different words that are used, but you do have to distinguish whether it's for a good reason or it's not for a good reason. So I'm going to say a few words about the consequences of parental alienation in the child. So first of all, what are the things that happen immediately? What are the short-term consequences of parental alienation? Well, the child gets out of the battleground. That there's been a fight going on between the parents and the child is in the middle. And so when the child becomes alienated, that's something that he accomplishes. He escapes from being in the battleground. And as a result, he becomes attached to one parent and enmeshed with the other parent, and enmeshed with that parent, the preferred parent. So when he's in the battleground, that is very uncomfortable. That's called cognitive dissonance, which has been studied when a person has conflicting opinions or experiences about something important. It's uncomfortable trying to have good feelings when you have these conflicting opinions. But by gravitating to one side, you resolve that problem. You don't have cognitive dissonance anymore. Of course, the bad thing is that you lose a relationship with one of your parents. So here are some long-term effects. And we like to separate them into behavioral effects, meaning that the child avoids or shuns a parent forever, maybe for years, maybe forever. Cognitive effects is that the child fails to develop critical thinking. You know, critical thinking, you have to figure out things for yourself. How do you feel? You have to figure out things for yourself. But if you've been influenced, if you've been indoctrinated to think a certain way, you have difficulty developing critical thinking. And there are emotional effects over a long period of time. Depression and unhappiness over losing a parent. And some of these children feel very, very guilty because the child knows that he or she participated in rejecting the parent. And the child might feel very, very bad about that. I want to say a few words about the history of parental alienation. And in particular, I just want to make sure that people understand that the origins of this concept came about in several different places with several different writers and people conducting research. And going all the way back to the 1970s, this type of thing was written about by Wallerstein and Kelly, who were working in California in the United States. And in 1985, Richard Gardner described parental alienation syndrome. He was a psychiatrist in New York. And about the same time, this lady named Leona Kopetsky was a social worker in Colorado in the United States. And she described the same thing. So what's important about these people is that they did this more or less separately. In other words, they had their own observations that they wrote about. And here are some more. Clower and Rivlin are a sociologist and a social worker in Pennsylvania, and they wrote this book called Children Held Hostage, in which they described indoctrination. And this other psychologist in California, Janet Johnston, described something similar in the 1980s. And finally, this psychologist in Philadelphia, whose name was Barry Bricklin, described something similar. In fact, he developed a test. He developed tests that could be used with children in doing a custody evaluation. So what's important is the idea that several different people made the same observations, which we now call parental alienation. And this was back in the 1980s. So since then, hundreds of people have observed this in many different countries. We developed this bibliography, and we have articles and books and book chapters from about 40 countries all over the world that describe parental alienation. So let me say in particular what happened with the Diagnostic and Statistical Manual of Mental Disorders. So the new edition was published, DSM-5 was published in 2013. And what's important about DSM-5 is that the name, the actual name, parental alienation, is not in DSM-5. But the idea is, the concept is, the description of it is in DSM-5, even though the name is not there. I'll give you an example. There's a new diagnosis in DSM-5 with a long name called child affected by parental relationship distress. And if you look in the book, the description of it is a paraphrase of what happens in parental alienation. For instance, it says, negative effects of parental relationship discord, like conflict, disparagement on a child in the family. So that's a little short description of what happens in parental alienation. What this means is that if a clinician, a psychologist, is doing an evaluation and there is a diagnosis of parental alienation, you can use this term. In your report, you can say, child affected by parental relationship distress. There's another diagnosis in DSM-5, which is parent-child relational problem. And that also, if you look at the paraphrase of that, at the definition of that, it's a paraphrase of what we talk about in parental alienation, having negative attributions of the other's intentions, unwarranted feelings of estrangement. And finally, in DSM-5, there's another diagnosis called child psychological abuse, and that can be used. So in countries that use the DSM-5, these three diagnoses can be used if you're writing a report or an evaluation of a child who has parental alienation. Some of this also happened in ICD-11, which came out a couple of years ago, that ICD-11 has a diagnosis the same as DSM, which is called caregiver-child relationship problem. And it's been a diagnosis in ICD-11 for a long time. And when the ICD-11 first came out, parental alienation was in the index of the book. And if you went to the index, or if you searched for that term in ICD-11, it took you to the index, and it referred the person to caregiver-child relational problem. So it was clear that since it was in the index, that a person can use that diagnosis if you have a case of parental alienation. So a problem happened, and there are a number of people who didn't want it to be in the ICD-11, and parental alienation was removed from the index. But nevertheless, the people who work at ICD-11 still say that if you do have a case of parental alienation, that it's fine to use that term, caregiver-child relationship problem. So in the future, we would like for parental alienation to be in both DSM and ICD. We would like for the actual words to be there, but in the meantime, we can use these other diagnoses if we have a case of parental alienation. And we've written about this. This is an article by me and some other people about what is the meaning of that diagnosis I mentioned, child affected by parental relationship distress. So I've covered several topics. The main thing I wanted to cover today was the 5-factor model for the identification and diagnosis of parental alienation. But I think we have time for a few questions. But you should think about this organization. This is the organization where I'm the president, and it's called Parental Alienation Study Group. And if you're interested, you can join this organization. You can simply go to our website, www.pasginfo. You can go to the website, and it says contact us, and you can send us a message. And also you can find a lot of information about parental alienation on the website. So thank you very much for being with us today. I appreciate that. And I think we have time for some discussion and some questions.
Я прошу прощения, у нас, видимо, какая-то техническая проблема. Одну секундочку. Да, алло. Сейчас, секундочку. Я прошу прощения, одну минутку. Какие-то технические сбои. Сейчас мы их устраним. Буквально. I'm sorry, William. Just a minute. Yes. Алло. Да, одну секундочку. Спасибо. Спасибо. Сейчас, дорогие друзья, пропал интернет у переводчика. Сейчас она подключится заново, и мы продолжим. Пока мы можем, вот, все, вернулась. Так, Мария, вы с нами? Так, чути. У нас вже, мабуть, є перше запитання, так? Я бачу, було запитання, з якого віку можна просити дитину заповнити табличку плюси, мінуси батька та матері. Вас чути? Не чуєте Вільяма? Алло?
Yes, I can.
Марія? Добре, добре. Тому, мабуть, перше запитання, так?
So
Maria.
the first question,
Марія. Перше от запитання від учасників, з якого віку можна просити дитину заповнити табличку плюси та мінуси батька та матері?
Okay, that's a good question. So the child does not write it down. I write it down, but I listen to what the child says. But I think that children who are quite young can carry on a little conversation, like children who are 4 or 5 can say, oh, I like mommy this, I like daddy that. But usually they're old.
Yeah.
Usually they're 7 or 8 or 9 when we have that kind of discussion.
Також наступне питання. Яка процедура проведення судебно-медицинської експертизи, яку застосовують зазвичай?
Okay, I can first tell you the steps. That first, sometimes the 2 attorneys agree on me to do the evaluation, or sometimes the judge orders the evaluation. And what I do in my office, I first meet with both parents together. And I tell them what we're going to do during the whole evaluation, and we schedule the meetings. And the next thing I do is I meet with each parent individually for maybe 2 hours or 3 hours, and I collect a history. I collect a history of the marriage, the divorce, information about this child, the other child, their concerns about the other parent, their own psychiatric history, their medical history, what we call the social history, meaning what kind of job do they have. So it takes me about 3 hours to collect that information from each parent. Then I see the child twice, because on one occasion, the mother brings the child, and on the other occasion, the father brings the child. And in that, I do a basic psychiatric evaluation of the child. Does the child have any significant mental problem? Is there anything that we need to be thinking about? Does the child need some sort of treatment for a mental disorder? But I also try to size up what is the child's relationship to the mom and the dad. Now, I already told you the thing about the list, things I like about mom, things I don't like. So that's one way you do that. But there are other ways of doing that. There's a common thing we do here, which is we talk about going on a visit to a deserted island. So we have to make sure, does the child know what an island is? Does the child know what a deserted island is? And suppose you're going to go on a trip. What would you take with you? What do you need? Do you need food? Do you need water? What else? All the things. In other words, we're making up a little story. And then we would say, who would you take with you on your trip to the deserted island? And the child is going to name the people that he trusts the most, or he relies on the most. And he might say, well, I'll take my mommy and my daddy. Well, I might say, well, we don't have enough room for everybody. We only have enough room to take one person. Who would you take? And the child might say, well, I think I'll take my daddy. And then I would say, well, why? Why? What is daddy good at? Why would you take your daddy? So this is just a little example of trying to find out, how does the child have a relationship with the parents? But I might also ask about preferences, and I might say, well, what is your schedule between this house and that house? And is there any way that you might want to improve your schedule by changing it one way or the other? And if so, why? But also, when I interview the child, I try to find out whether the child has been indoctrinated in some way. And so earlier in my webinar, I went over the 8 common symptoms that children have who are alienated. And so I look for those. Does the child criticize one parent? Does the child say one parent is all good and the other is all bad? Does the child want to get rid of the grandparents, and so on? So that's what I do in my interview with the child. Then I collect information from other people, aunts and uncles sometimes, or teachers. Then, and the next thing I do is testing. I do some psychological testing. And for instance, a common test for the parents is the Minnesota Multiphasic Personality Inventory. And then there are some tests that can be used with children. Incidentally, I wrote this article a number of years ago, and I sent it to Simone. So I think he may have it. It's called this is the article, it's called Child Custody Evaluations by William Bernet. And so the article actually summarizes the steps for doing the evaluation. Incidentally, there are certain, what do we take into consideration? So one thing are, what are the steps? But the other thing is, what are the things we take into consideration? And, we take into consideration things like parenting skills. Does one parent appear to have a really much better relationship? What has been the history of caretaking in the child? Are there mental health issues? Are there psychiatric issues that one parent might be impaired in some way? Are there allegations of abuse? Have one or the other parent been abusive? Has one or the other parent indoctrinated the child? So nowadays, there's a big emphasis on shared parenting. So we really do look to see, is shared parenting, meaning that both the child stays with both the mom and the dad. And they might go back 1 week with mom, 1 week with dad. So that's really a good way to go if it's possible. That's not always possible, because suppose one parent has moved to another city. Well, in that case, the child has to live with one parent and visit the second parent. Or suppose one parent does have a serious psychiatric disorder, or one parent has a substance abuse problem with alcohol or with drugs. So sometimes you really do have to decide that one parent would be better than the other. So anyway, those are the steps I go through in doing a custody evaluation. And other people do similar things. There's no rule, at least in the United States, there's no rule that you have to do it this way, exact way. Different people have a little bit different ways of doing a custody evaluation, but they usually cover the things that I just described.
Вот запитання англійською стосовно того, що робити, якщо одна з сторін не бажає надавати дитину експерту до спілкування з експертом. What is practical in this case?
Yes. So if the court has ordered it, the court says to the mom and the dad, both of you must go see and have the evaluation, and you must take the child. And always, at least in my experience, almost always, both parents do what the court says to do. If they don't, I would write a letter back to the judge and I would say, the mom or the dad won't come. And the judge would then take that into consideration in making a decision. Now, there are some situations, for instance, the dad might say, not, in other words, the court hasn't said anything, but the dad might come in and say, I want to come and see you and I want to bring my child. Well, first of all, for the dad to do that, the dad has to have the right to do it. You know, the dad has to have shared parenting or shared custody or to bring the child. And if he does, then I can make an evaluation of the dad and I can make an evaluation of the child. But I cannot say which one is better. For instance, if I have only seen the dad and I have not seen the mom, I cannot say that the dad should have custody or that the child should spend most of the time with the dad. In other words, if I have not seen the mom, I cannot have an opinion about her. So that's important, that in almost everywhere, psychologists and psychiatrists are not supposed to give opinions if they have not actually seen somebody.
Зрозуміло. Ну, запитують, чи має давати конкретний запит психологу, що саме досліджувати психологу?
Usually, in the United States, it's rather general that it's common for courts to order a child custody evaluation, and the court wants to know what are the strengths and weaknesses of the mother, what are the strengths and weaknesses of the father, and does the child have a good relationship with one or the other, and is there indoctrination happening? Now, usually the court wants to have an opinion about recommendations. Should this have shared parenting, or the mother have custody, or the father? Occasionally, the court doesn't want recommendations, and this is somewhat up to the judge. Occasionally, the judge will say, I just want an evaluation of the mother, an evaluation of the father and the child, but don't tell me what to do. Don't make any recommendations. That the court says, I will make the recommendation. So occasionally, one judge is different from another judge. Most of the time, the judge wants information about mother, the father, the child, and conclusions and recommendations. Most of the time, that's what they want. Occasionally, they don't want recommendations. Now, here's another thing. Does the court want a diagnosis? Usually, in a custody evaluation, you don't need a diagnosis. You need to talk about the strengths and weaknesses of one parent, the strengths and weaknesses of the other parent. So usually, the diagnosis is unnecessary, but sometimes it is necessary. For instance, if a parent has a really serious mental disorder, like say, a parent has schizophrenia or bipolar, or if a parent has a serious drug problem or alcohol problem, then it's good to give the diagnosis. But a lot of times you don't need the diagnosis. You just need behaviors. What are the dad's behaviors with the child? What are the mom's behaviors with the child is what's important.
Ще наступне запитання. Чи є висновок експерта для суду основним фактором, на який він покладається при винесенні рішення?
Well, usually it's a big factor. The report is, especially if it's well done. If it's a poor report, or if the evaluator is not very good, then the judge will not pay much attention. But usually, if the evaluator has seen everybody, the mother, the father, the children, and if it's well written, and I can tell you what we put in the report, just for your information, we put identifying information, who is it? Referral information, like where did this come from? Did the judge order it? Did the attorneys agree? You know, how did I come to do this? What is my procedure? What are the steps that I took to do the evaluation? What are my observations? So observations is information about the mother, information about the father, information about each child, information I collected from other people, and testing. Those are all observations. And then the next part is conclusions. What are the conclusions? What are the strengths and weaknesses of this person? Does the child have an attachment to this or that? Is the child appear to be indoctrinated? Those are conclusions. And then finally, recommendations. And almost always the court wants recommendations, although I mentioned that sometimes, occasionally they don't. But I make recommendations as to, should there be shared parenting? Should the child stay mainly with mother or with father? Should the child have a treatment program, a certain kind of treatment program? So that's the kind of thing that I put in the report. And I think almost always the judge gives a heavy weight to the report. But also we have to go testify. Usually if you give a report, you have to also go testify in court in order to explain your report. I think this is done differently in different countries, I'm sure, but this is what I'm describing in the United States.
Ще запитання. От пані Олена питає, що відсутній єдиний регламент проведення експертизи, і експерт визначає спосіб проведення дослідження самостійно. Тоді яким чином оцінюється висновок і чи існують вимоги до експерта? Якісь ліцензії чи якісь інші критерії?
Yes. You know, I agree there needs to be more uniformity. And there are big associations here that have created guidelines. For instance, my organization, the American Academy of Child and Adolescent Psychiatry, we published guidelines for how to do a child custody evaluation. And then this other organization called AFCC, the Association of Family and Conciliation Courts, which is an organization here in the United States, but it has members from many, many countries. So the AFCC has published guidelines on how to do a child custody evaluation. And many people try to follow those guidelines. And it is important. I agree with the person who asked the question. There needs to be a consensus or a general agreement on how to do this. You don't have to agree on every single sentence, but there needs to be a general agreement. And those organizations are important. I think that the American Psychological Association has published guidelines, and maybe organizations in other countries. So I hope that more and more countries and more professional organizations will publish guidelines and agree on the general principles. That's very important.
Добре, ще запитання. Можна ли для діагностування відчуження використовувати проєктивну вербально-візуальну методику Рене Жиля? Ну, якщо це загальновідома методика.
Projective, I don't think I'm not familiar with. Can you say the name of the person again?
Рене Жиль. Мабуть, так. Рене Жиль. Рене Жиль.
Yeah, I don't know that person. There are some tests that are very common. I mentioned one, the MMPI, the Minnesota Multiphasic Personality Inventory. And there are some tests that are used with children, but there's one called the Family Relations Test, which was published recently by some people in the United Kingdom. It's an old test, but it was used in divorce, and it helps explain how the child perceives the mom and the dad and other people. So there are some, but I'm not aware of any tests with the children that's required. Different people use different ones that are acceptable, but I don't think there's any particular test that's required.
Ну, вот еще запитують, чи можна у вас попросити методики. Українські фахівці, експерти запитують, чи можна попросити у пана Вільяма методики проведення дослідження.
Well, the methodology, as I mentioned, was in this article, which is right here, called Child Custody Evaluation. And I sent that to Simone Jen, and he can send it to you. But the methodology by these organizations are published on their website for free. And AFCC, Association of Family Conciliation Court, has a guideline for conducting a child custody evaluation. And so that's available. If you go to their website, you should be able to find that. I think I can also send that to Simone, and he can distribute it if you want.
Шановні учасники, ми через певний період часу зробимо переклад цієї статті, на яку посилається пан Вільям, і потім надамо вам її. Я так розумію, що можна це зробити в вільному доступі, так, пан Вільям?
Yes, that would be good.
Ми це обов'язково зробимо, але нам потрібен короткий, але деякий час на те, щоб перевести, та ми обов'язково викладемо на Фейсбук-страниці і на сайті PAS-центр. Ще які запитання, шановні друзі, тому що ми вже, мабуть, багато уваги привернули пана Вільяма, часу його використали. Ну, тут є якісь питання, як відносити до тих психологів, суддів, сприймаючих небажання дитини як доказ для полишення дитини з аліенатором. Ну, це, мабуть, питання не до фахівців, психологів, а до наших суддів, так? З якого віку діагностується відчуження, запитують.
Oh, first of all, everybody needs education. The judges, the attorneys, the psychologists, everybody needs to have more education about this. That's why we wanted the ICD and the DSM to have it, because more people would be educated. I think you can have a diagnosis even if a child is around 4 or 5, but it's more clear if the child is 8 or 9 or 10, because then the child is expressing strongly their opinion. A little kid who's 4 or 5 might have an opinion, but then it has a different opinion. And then when it's with mommy, it's good. When it's with daddy, it's good. They have to be a little bit older, 7, 8, 9, in order to have a strong opinion in which they say, I don't want to go see mommy. So little children, not so much, but certainly older children and certainly teenagers. As you know, teenagers can be very opinionated, and they form an opinion, even though it's a false opinion. They can be very easily to manipulate them into having false opinions. Incidentally, with all this, you mentioned young children. It's really important for psychologists to identify alienation in the beginning when it's only mild. When it's only mild, you can correct it. The psychologist can say, do this, or the judge can say, do this, do this. In mild cases, you can usually get the parents to cooperate. In more severe cases, it's very, very hard. And so everybody, judges and psychologists and attorneys, should be looking for this when it's only mild, because then you can help correct it more easily.
Тоді, може, останнє запитання. А яким чином запроваджуються корекційні програми для дитини та для відчужуючого з батьків? Чи є це примусовим? І хто це втілює в життя? Хто це реалізує? Психологи, психіатри, судові пристави?
Okay, so you're talking about interventions or treatments, I think. The court, in really severe cases, the court has to make a big decision, perhaps moving the child from one parent to the other, perhaps ordering certain interventions to happen, certain forms of treatment. And the court has to follow up. In other words, what we typically do is we'll have a trial. The court will give decisions. The court will say, do this, do this, do this. And then the court will say, I want you to come back in 90 days, in 3 months, or in 90 days. You must come back, everybody come back and tell me what has happened. Have you followed through? Have you done everything? How did it turn out? And the court has to have the people come back. Now, I'm talking about in severe cases. In mild cases, you don't. I mean, mild cases, the court says, do this, and go home. And, and don't come back unless you have to. But in severe cases, the court really has to stay in touch and follow up and have them come back. Because if it didn't work, they need to do something else.
Протягом цих 90 днів дитина та батьки спілкуються з психологами, психіатрами, або на свій розсуд щось вчинюють.
Yes. Yes, they have to. Now, I'm talking really severe cases. The child is removed from the preferred parent and put with the rejected parent. And then a psychologist helps them get along and be with each other. But the preferred parent is required to go see her own psychologist. And she has to be trained and coached to behave differently. And in severe cases, it's very hard for the preferred parent to change what they have been doing for many years. I mean, it's very hard. And so somebody has to work with them, and they have to work. The preferred parent has to see that person. And when they come back to court, the therapist reports back as to whether they made progress. And so we hope that in the end, the child will see both parents. We'll see one parent and we'll see the other parent. That is what we hope. But that's hard sometimes to make that happen.
А якщо через 90 днів нічого не змінилося?
If there's no improvement in the favored parent, in the alienating parent, if there's no improvement, she does not get to see the children. If there's no improvement, the children stay with the dad, say, if he's the parent. And hopefully by now, the children are getting along with dad. Usually they are. And in most cases, the children go to the rejected parent and do fine in most cases. And if the preferred parent has not changed, the judge does not let her see the children. Or the judge might do this. The judge might say, you can see your children for 1 hour, every 2 weeks, for 1 hour, supervised. In other words, the judge might let the alienating parent see the children briefly, but they have to be supervised so that they don't damage the children. I mean, sometimes that's the outcome. We hope not. I mean, we hope that the child in the end can see both the mother and the father.
А якщо він не виконає це рішення суду? Ну, наприклад, не віддасть дитину.
Yes, correct. The child is not asked, the child is not required to see that parent if that parent has not improved. Now, what I'm saying is what most people would recommend. Now, the judge can do what he wants. Yeah, the judge doesn't have to do what I just said. The judge can say, oh, well, it doesn't matter. The children can go back to see the alienating parent and we'll see what happens. So what I have been saying here is what most...
А дитина ж звикла жити з відчужуючим батьком, вона ж його любить, вона ж віддає йому перевагу. Вона ж не піде до відчуженого з батьків.
Well, obviously these things are confusing for the children. Most of the time, if the child goes to live with the rejected parent, most of the time they do fine. Now, there are a small number of cases where the child never wants to do that and wants to go back to the parent who originally was the alienating or preferred parent. So sometimes that happens. Sometimes in a small number of cases, the child wants to go back to the favored parent, and that happens, and the rejected parent doesn't see the children. Sometimes that happens. And that's, the judge can decide, the judges are in charge. They can decide one way or the other. Or the children sometimes run away and end up in some place. So
А хто виконує такі рішення, вибачаюсь?
People who have studied the outcome say that most of the time it works to put the children with the previously rejected parent. Most of the time that works. Sometimes it does not work. So that's why we should try to intervene in the very beginning when it's mild and help people then. Well, the court orders are very detailed. The judge will say the child is going to go live with, say, the dad. And the judge will order the mother has no contact, no telephone, no visits, no email, no messages being sent through other people. And they're very detailed orders. And if the mother violates that, then they go back to court and the judge can put her in jail. I mean, if a court gives an order and the parent violates the court order, that's called contempt of court. And the judge can put that, can fine that person money, or can put that person in jail for contempt of court. I've had cases where that has happened with a mother and with a father. So the court has the ability, at least in the United States, the court has the ability to reinforce and to punish people for not following orders.
Зрозуміло, дякую. Шановні друзі, які ще є запитання до пана Вільяма? Якщо більше запитань нема, то я ще раз хочу дуже подякувати пана Вільяма Бернета та Parental Alienation Study Group за співпрацю, за можливість отримати таку дуже корисну, практичну інформацію. Ми обов'язково переведемо статтю, яку любезно надав нам пан Вільям. Вона також буде і на нашому сайті, і думаю, що українською мовою на сайті Parental Passage Info. І ми обов'язково викладемо у вільний доступ запис цього вебінару. Тому я ще раз хочу подякувати усім учасникам, Марії за переклад, Еліні за організацію та, беззаперечно, пану Вільяму за таку корисну співпрацю. Я дуже вдячний і сподіваюся, що цей вебінар буде ще одним кроком до врегулювання, в тому числі на законодавчому рівні, питання відчуження одного з батьків в Україні. Дуже вдячний, дуже вдячний. Дуже дякую. Thank you very much.
Goodbye.
До побачення.